You would think that all appointments are preventive appointments, but not necessarily. We have to divide them into preventive and restorative, don't we? At least when we're dealing with restorative dentistry. A preventive appointment is something that some dentists have made as a separate entity for a lot of people, where they sit down with the patient and educate the patient. But primarily, there are a lot of people who fit into the need for a preventive appointment. And as you read that list, you will see, if you're practicing general dentistry, you have every one of those in your practice. It's estimated to be about 10% of patients. 10% is still quite a few. A typical American practice has 2,000 patients in it, so that's 200 patients. Valinda, who's been working with me forever, has done a lot of preventive appointments. Valinda, what is a preventive appointment?
We call a preventive appointment when we make impressions, pour casts, and then make special trays just for that patient.
What are the trays made of?
It's the heavy material that we use for like suck downs, what we used to use for bleach trays, but the rigid material. We want to have a good, nice vacuum formed tray that we make, and we want the tray to extend beyond the tooth structure and actually go up into the tissue just about a millimeter, so
Why?
we can create a nice hermetic seal.
That's right. So you make that for upper and lower? Do they go in at the same time?
We do usually have them use both trays. We teach them, after we make them, we teach the patient how to use it by showing them with the fluoride that we want them to use. We use Prevident gel, and we will have them place 5 to 6 drops around the tray after they've cleaned their teeth really well, brushed, flossed. Usually before bed, then we'll have them place the tray in their mouth for 5 minutes at least. 5 minutes once a day is great. If you can even do it in the morning, if they'll do that for you, it will help even more so. But put the tray in, spit out any extra fluoride that might have come out of the tray, spit that out, and then sit there for 5 minutes. They can read a book or watch TV for that period of time.
How long is this appointment?
The appointment itself, that we make the tray, we can do it in about a half an hour with the impressions. We pour up the casts in fast-setting stone. We use Whip-Mix Snap Stone, and it sets up in about 5 to 10 minutes, so we can trim and go ahead and make the trays.
And is that done by both hygienists and assistants?
Yes.
And this is one of the 20 responsibilities we provide for hygienists. Hygienists need more variety in what they do. That's been well known psychologically, that about 5 years into hygiene, most of them are looking for some variety. So this is one of those things. They pick them out. They explain it to the patient, what's happening, and highly effective. We've done this on a lot of chemotherapy, radiation therapy people, and surprisingly, almost no lesions develop if they are conscientious.
Absolutely.
Almost none. So it's something you need to incorporate into your practice. And considering, let's say it's about the cost of one composite class 1 or a small class 2. And that's different in various parts of the country or various countries outside of the U.S. So it takes about a half an hour. It's easy to do. It's a variety for the assistant or hygienist, and you have a revenue stream.
Absolutely.
It's effective to the point where I mandate to those who are going into chemo or radiation that they actually sign a piece of paper that they will use this concept the rest of their life. Now that's asking quite a bit. If they do, we've had patients where we've done 1 or 2 little patches?
Couple patches.
After the chemo and radiation.
If we can catch them before they start the treatment and have these trays made and they use them, it really does save their teeth.
Go for it. Thanks for being with us. Join us next week.